Good afternoon. My name is Barry Bialik. I'm a fully licensed physician here in the state of Colorado. That's a good thing for you guys to know, because if I had any restrictions on my license, then my signature would not work on the application. You're here because cannabis, or medical cannabis, is something that you think is going to be of benefit for you. And after the exam, that's the way it works, I'll be able to tell you if I can recommend you or not. Now I start with this. Anybody know what this is? Raise your hand. I know this is a video. How can I know? This is a singing bowl. This is from the same part of the world, and the same type of medicine that cannabis, then known as ganja, came from. It's part of the Hindu-Buddhist tradition, part of Ayurvedic medicine. The reason I bring this up is you think that you're coming here for something that is a brand new aspect of medicine. And it's actually a very old aspect. It goes back at least 4,800 years. The picture in here, I'm not sure if you can see this, is a picture of Buddha. He's the Buddha part of the Hindu-Buddhist tradition. And underneath this is a symbol called Om. Now, Om is Ah, U, Ma, which stands for the three faces of God in the Hindu-Buddhist tradition, for Brahma, Vishnu, Shiva. I'm getting someplace with this, guys. Brahma, the face of birth. Vishnu, the face of life. Shiva, the face of death. And in that tradition, Shiva smokes ganja. Shiva smokes cannabis. It's not something that is illegal. It's not something that is heinous. It's not something that makes people crazy. It's something that, for some people, brings them closer to God. A different perspective than we have here in the West. So, with that perspective that you're now entering something in medicine that is very old, and in allopathic medicine, that's the MD medicine that I practice, that we practice here in the West, you're going to be learning a little bit more. Cannabis as medicine. Now, cannabis. I encourage you, when you say anything about this field, use the term cannabis rather than marijuana. And the reason is political and economic. Marijuana was a term that came in the 1920s. At the time, people knew either hemp or cannabis. They didn't know the term marijuana. And for financial reasons, notably that there was a lot of cotton that Hearst and DuPont owned, and there was a lot of hemp that they didn't, that was a better product, they figured make it illegal and therefore they'll get the market, which they did. And here's the story. Hordes, literally hordes of Mexican men were smoking this weed they found by the side of the road. And it made them crazy. So they called it loco weed. And they crossed our borders and they raped our women and they plundered our small towns. Just what you'd expect a bunch of guys getting stoned to do. They'd say, yo dude, let's go rape and plunder, right? They don't. This was the weapons of mass destruction back in the 1920s. So I encourage you, for political reasons and for ethnic reasons, don't use the term marijuana. It's a racial slur against Mexico. Use the term cannabis. Okay, so where do we go? In the state of Colorado, there are 8 conditions for which a person may be recommended medical cannabis. Cancer, glaucoma, HIV or AIDS, cachexia, which means severe wasting, physical wasting, severe pain, severe nausea, persistent muscle spasms, and seizures. All of these have scientific basis, and that's why they made it into the Constitution of Colorado. If you are recommended for cannabis in the state of Colorado, it must be for one of these 8 conditions. If you don't have one, you won't get a recommendation. That's the law. If you do get a recommendation, you'll be able to use cannabis for other reasons as well if you find it effective, such as for insomnia, for anxiety, depression, for PTSD, for asthma, for hypertension, perhaps even for some cancers. There's a lot of science that's coming out that really supports this as a medicine. So if you do get recommended, you'll be able to use cannabis any way you see fit. So, all of these conditions are chronic. That means generally 6 months or more. I imagine all of you have had your condition for a while, right? Well, you're not coming here expecting a cure in general. So, not that you wouldn't like one, but you're not expecting one. All of these are chronic conditions, meaning generally 6 months or more. For that, people generally are not looking for cure, although they'd like it. Generally, what people are looking for is symptom management. So, symptom management starts with diagnosis. You've come here, you've seen other doctors, you have your diagnosis, which brings you into one of the 8 conditions. You're going to tell me. Probably I'll agree. Maybe because my training and experience are slightly different, I'll come up with a different diagnosis. If so, I'll explain it to you. If you agree, fine, we'll use that diagnosis as the basis of your comprehensive plan. If you don't agree, or if you don't understand, you have to tell us. And there's only one stupid question. That's the one you don't ask. Please ask. You're here, this is about your health. Ask questions. They're yours to ask, and ours to answer if we can. So, 3 parts to any comprehensive plan. Number 1, health promotion. Number 2, disease prevention. Number 3, treatment. So health promotion, do things that make you healthy. Eat well. And for some people, especially don't eat too well. And the idea is, if you think you can be eating in a more healthy way, and it would be easy to eat even healthier, do that. If it's not easy, then you're probably doing a good job. Exercise. That's the second part of health promotion. Most people have an exercise program, but they may or may not have one that's designed that's best for them. So I have 2 parts to it. Number 1, figure out what you like to do and what you are exercising so that you can do. So for me, my favorite thing in the world is hiking in the Himalayas. I do that every year. Take my students with me. And I want to enjoy myself while I'm doing it, so my exercise is I run. I run on hills in the trails here in the foothills of Colorado. The second part of designing your program is do the exercises properly. Too many of us say, I know how to do a push-up, I know how to do a sit-up, I know how to run, and we don't do it properly, so we end up hurting ourselves. Or we do too much too early. So the idea is have somebody who knows what they're doing watch you. See the exercises you're doing, make sure that you're doing them properly, and then go on and do them on your own. Those 2 really deal with how you deal with yourself, the food you eat, the exercise you do. The others deal with your environment, which is also really important. And I can tell you, having just turned 60, that your environment is hugely important. So, love your family and friends. Make the world a better place. So, part 2, disease prevention. Figure out what causes you discomfort in the things you like to do and do them differently. And I'm not telling you to stop doing what you like to do because it hurts. What I'm saying is figure out how to keep on doing it. So here's the example. One of my patients came in, a snowboarder. I do see snowboarders in my line of work. He came in with a DVD, and there's his smiling face, so I knew it was him. And then it pans out, he takes a 50-foot jump, he comes down 70 feet on ice on his right shoulder, which no longer works. So yes, he has a reason, his condition is severe pain, he qualifies. But then he said, what can I do, doc? And I did not say stop snowboarding, stop jumping. What I said was, before you take another jump, take a lesson. Maybe you should go to a gymnastics class and get in the harness, get the bungees, and perfect your performance where you're landing in air rather than on ice. So figure out some ways to do what you really like to do and modify the way you're doing them so you don't hurt yourself. Brings us to number 3, treatment. If there is a cure, great. If there isn't a cure, then what we're looking at is symptom management. Symptom management generally is enabling you to have a fuller, higher quality of life than you have right now. And that's something that I think you all want. At least I do. So, there are a whole variety of different healing arts that can be helpful. If you start with health promotion, continue with disease prevention, and then add some treatments, they can be allopathic, so maybe it is surgery, maybe it is physiotherapy, maybe traditional Chinese medicine is part of it, maybe massage therapy or chiropractic. There are a variety of different healing arts that are treatments that can help you as well. But if you really start with your foundation strong in health promotion and then follow it with disease prevention, you have a much better chance of being healthy, at least much healthier than you are right now. Okay, here's the next part, something that you guys are interested in. So, cannabis. We have heard about indica, we have heard about sativa, and we have heard that indica is the body high, sativa is the mind high. Instead of thinking indica and sativa and the 22,000 varieties that are either pure or hybrids, what I want you to be thinking about is cannabinoids. These are active ingredients in every cannabis plant. So most of us have heard of THC. It stands for tetrahydrocannabinol. Most of us have not heard about the other 100+ active ingredients. So there's CBD, cannabidiol, CBC, CBG, CBN, CBM, THCV, and those are the ones I know about. There are a lot more. Every plant has all of them. So from now on, I want you guys to be thinking not in terms of indica or sativa. I want you to be thinking in terms of THC and CBD. So, why do they work? Well, it's interesting to know that there's a chemical called endorphin. You've heard of that. It stands for endogenous morphine. Endogenous means made by the body. So you might not have known, or maybe you did, that the body makes its own morphine. And there are receptors in the body for morphine. So that if the body is making it, or if the body takes it in, like on a pill or an injection, our mind doesn't know the difference. The receptor is being struck, and the morphine, opium derivative, whatever that opiate is, takes effect. That's why morphine works in our body, because our body makes something very similar. In the same way, there's the endocannabinoid system. Endogenous cannabinoids. Indeed, our bodies make cannabis. And what we know so far is our body makes at least two types. One is like THC, one is like CBD. And the receptors for THC are in the brain. That's why high THC content gives the mind high, intoxicates. The CBD receptors are in the body. And that's why CBD, and it's higher in indica than sativa, gives a body high, relaxes, but does not intoxicate. So usually THC is about 95% or more of the total active ingredient of these 100 ingredients, and CBD is about 1 to 3%. But now we're getting plants that are over 50% CBD, and generally it's CBD that is the medicine. So we'll talk specifically based on your diagnosis, but if we're looking for medicine, it's generally CBD, and I don't want you thinking indica. I want you to actually look at the laboratory analysis of the medicine, because in this state, that's where we're going. A lot of different dispensaries do have them now, the laboratory testing, so you can get medicines, see how much percent, how many milligrams, and then you can know. Okay. So to finish up the cannabis, you guys have seen the edibles. This is tincture. Each drop in here is 3.74 milligrams of total active ingredient, of which 95% is THC, 2% is CBD, and 2% is CBN, which helps people sleep. So this is the way I generally recommend the medicine, for a couple of reasons. Number one, when you eat it, and that means swallowing it, it takes about an hour to be effective, but it lasts for 6 hours. So you have that time period of an hour when the medicine is in you, but you don't feel it. Then you have the effect for about 6 hours. That's how to make it last longest. The problem is it takes an hour to be effective. So some people take a couple of drops, they wait 5 minutes, they say, I didn't feel anything, and they drink the bottle with 150 doses. So they overdose. They feel bad. They may get bad headaches, nauseous, throw up, sleep it off for a day or two, and they will never want to do it again. Now, on the other hand, in 4,800 years, no one has ever died from a lethal overdose of cannabis. So theoretically, if you had 1,000 bottles, you still would not die. So I don't recommend it. I'm just letting you know the safety level is very high with this in terms of lethal dose. There is none that we know. The next really good way to do it is as an ointment. So if you look at this, this one's a stick. Rub it on whatever musculoskeletal area hurts, like your neck, your elbow, your knee, whatever hurts. Do it 3-4 times a day, and it really reduces the pain, gives you more mobility. If you ever think about using an ointment like Bengay or Icy Hot, this cannabis ointment, way better. Finally, there is vaporizing and smoking, which are the breathables. Vaporizing is 250 degrees, smoking is 525 degrees. Vaporizing does not burn any of the active ingredient, it just vaporizes it so it's breathed in. Smoking actually destroys half the active ingredients, so you have to use twice as much. Also, you get some of the tars and other carcinogens depending on what you are smoking it in. And here's a little hint. There's another way to use this if you want it to act quickly, but only last for about 2 hours, is put the medicine dose under the tongue. Don't swallow for 2 minutes. You'll feel it within about 5. So, now we can go over to the symptom tracker. This is for you. If you take a look at it, next time you're going to treat your condition or any symptom you have with cannabis, fill in a line. First 4 deal with the symptom. So what time did it start? Where was it, especially if it's a pain? Number 3 is how bad is it on a scale of 0 to 10, where 0 is no pain and 10 is as bad as it gets. And then the 4th column is what caused it, so that perhaps you can figure out what to prevent in the future. The 5th column is your treatment. The 6th column, again, is 2 hours later after treatment. How do you feel 0 to 10? So it'll give you a number before and after treatment. And then you'll know how good the treatment is. Be very specific in your treatment because you want to be able to reproduce the ones that work and not reproduce the ones that didn't work. So smoked a bowl doesn't give you much information. If instead you say, I took tincture number 1, and you have the lab analysis, 3 drops orally. That will tell you exactly what you did so you can reproduce it. Then, if all you're doing is using cannabis, remember, as great a medicine as it is, it's only a medicine. And a medicine by itself will not give as good a result as if you put a healthy behavior in. So, as an example, if it's my low back, in addition to cannabis, what I would do is maybe stretch or do a yoga pose. Maybe call my mom, tell her I love her. So, that is your educational piece. And now if we could stop, and I'll ask you guys to ask questions.